Hello, everyone. Very good morning to you. I'm Radharani Mitra. I'm the Global Creative Advisor at BBC Media Action, which is BBC's international charity that uses media and communications for good. I've been with the BBC for it's going to be 15 years in Feb, and working across many thematic areas, creating communication solutions to bring about change. And I'm really happy to be here today. The sun is smiling today, and I can actually see the high-rise buildings far away in the distance, which is not a sight we can take for granted for those of us who live in the National Capital Region. So it's a very good day indeed. I'm really happy to be moderating this session, and it takes me back to the days of our childhood, something that we all used to do, and I hope we continue to do every day at our workplace. It's the joining of dots, because today's session is essentially focusing on joining the dots between inclusion, innovation, and partnerships. And these are the pillars on which most of our communication solutions are usually built on, or ought to be built on. I've got two presenters, two panelists here today with us, and I'm going to do a quick introduction of both of them. The first one is Sarah Tanishka Nathan. She is a social design researcher working at the intersection of participatory design and behavioral science. Sarah is currently working as lead family planning and reproductive health at Vihara Innovation Network. Over the years, Sarah has developed community-centric solutions across public health, planetary health, gender, and education. That's an impressive spectrum of thematic areas to work on, Sarah. She's deeply passionate about building innovations at the confluence of local wisdom and design on various projects supported by the World Health Organization, the Bill and Melinda Gates Foundation, UN Women, World Design Organization, the National Health Mission in Uttar Pradesh, and Stanford University, among others. Our second panelist today is Miriam Nipkens. Miriam has a background in nutrition and public health and is part of the workforce nutrition team at the Global Alliance for Improved Nutrition, an organization we all know instantly as GAIN. GAIN is a Swiss-based foundation launched at the United Nations in 2002 to tackle the human suffering caused by malnutrition. Working with governments, businesses, and civil society, Miriam, like all her colleagues at GAIN, aims to transform food systems so that they deliver more nutritious foods for all people, especially the most vulnerable. Through the Workforce Nutrition Program, the WFN program at GAIN, she is one of the people who aims to improve the nutrition of workers and farmers in low and middle income countries or communities. At BBC Media Action, one of the values that I've worked with for now over a decade is that the communities we serve are at the heart of everything we do. And in both these presentations, you will see our panelists sharing their work, their experiences, and lesson learned, keeping this value at the heart. And basically, again, like I said, joining the dots between the needs of the community to thinking out of the box and seeing how they can use different partnerships in order to bring about, or in order to test solutions and take them to scale after they have learned the lessons and the things that they have proved. Now, I will quickly move on to the sessions themselves because we are not here to hear me. So I'll first request Sarah to take us through her session. In today's session, Sarah will be presenting a project she led at Community Empowerment Lab. It's a community-entrenched global health research nonprofit organization working on newborn survival in UP. She will be sharing some insights on how a cross-department partnership with the Uttar Pradesh State Road Transportation led to development of a contextually relevant bunch of SBCC materials by employing co-creation, which is, as we all know, a participatory approach to design. So Sarah, without any more words from me, over to you. We'd be actually running a pre-recorded presentation done by Sarah on this. And just to headline her presentation, it is about using the approach of co-creation to design culturally appropriate SBCC materials for Uttar Pradesh's first breastfeeding cubicle. Over to you, Sarah. Thank you.
A very good morning, good afternoon, good evening, or rather greetings of the hour, everyone. My name is Sarah Tanishka Nathan. I am a social design researcher from India, and today I shall be taking you through a project that I led at Community Empowerment Lab back in 2019. And I will be talking about how we used co-creation to design culturally appropriate SBCC materials for Uttar Pradesh's first breastfeeding cubicle at a public bus station. So the biggest state of India, Uttar Pradesh or UP, has the highest population but extremely low and compromised development indicators. Annually, the state loses about 200,000 newborns, making it the global epicenter for neonatal deaths. However, simple interventions like early initiation of breastfeeding within 24 hours after birth and exclusive breastfeeding till 6 months aid newborn survival. In fact, exclusive breastfeeding till 6 months has the potential to save about 8,20,000 babies. But despite ongoing awareness and advocacy around benefits of breastfeeding, the progress and uptake still remains low. The National Family Health Survey 5 reports only 23% children under the age of 3 years were breastfed within 1 hour of birth, and 59.7% infants under the age of 6 months were exclusively breastfed. So, in order to improve breastfeeding outcomes, in 2019, the Uttar Pradesh State Road Transportation (UPSRTC) decided to establish breastfeeding cubicles in bus stations across the state. The idea of having a comfortable private space to breastfeed at public bus stations was actually birthed when the managing director of UPSRTC, Dr. Rajshekhar, was taken aback to see a mother struggling to freely nurse her infant in a busy bus station in the city of Lucknow. As a result, our team at the Community Empowerment Lab was commissioned to design the wall panels for the breastfeeding cubicle over a 10-day sprint. The aim was to create an enabling environment for breastfeeding within the bus station, communicate the value around breastfeeding and respectful care for lactating mothers through design, thereby shaping behaviors and reinforcing ideal behaviors around breastfeeding through nudges in the form of SBCC materials, that is, the wall panels. So the project had two main phases: sense making and iterative design phase. So we began by mapping potential personas based on insights gained from an ongoing study on strengthening breastfeeding practices through crango mother care. This was followed by conducting exploratory unstructured interviews with urban and rural lactating mothers, as well as agramas, who are a cadre of respectful care champions stationed at the kangaroo care lounges in public health hospitals of Raebareli district. The Breastfeeding Support for Indian Moms, BSIM, a peer group on Facebook which aims at empowering mothers around breastfeeding, was also used as a platform to understand common challenges around breastfeeding while traveling from a larger sample set. Additionally, methods like role play and journey map were employed to build deep empathy and understand the current mental models of our users. This was accompanied by review of existing communication materials on infant nutrition. Subsequently, the process of concept development began, which included conceptualizing the theme, messaging architecture, type of visual imagery, colors and fonts, etc. Once finalized, the wall panels were designed and rigorously tested with lactating mothers at every step. Insights from consultations with key stakeholders within the public health system and UPSRTC were also included throughout the design process. The approved design version was then implemented at Kesarbagh bus station in Lucknow. So from the sense-making activities, we learnt that the women availing the services of UPSRTC buses belong to middle and low-income families. Broadly, they can be categorized into A. Mothers of infants younger than 6 months, B. Mothers of infants older than 6 months. From our research, it was found that most mothers avoid traveling during the early months of the infant. Therefore, our focus was on infants above 4 months, which meant that it was a mixture of breastfeeding infants as well as those on complementary feeding. As a result, one of the challenges for us was to really bring a balance between information for these two infant categories in the existing architecture of the cubicle, with a major focus on, of course, reinforcing breastfeeding behavior. Therefore, the messaging content for the wall panels were developed for both the infant categories with the common goal of calming down a hurried and anxious traveling mother in those 10-15 minutes of the breastfeeding episode inside the cubicle. On reviewing the existing SBCC materials on infant nutrition, it was found that the tonality of the messaging was very instructive and direct. The desirable outcome, that is, exclusive breastfeeding, was stated quite explicitly and contradicted the beneficiary's underlying socio-cultural reasoning. Therefore, our approach was instead to create a system that shifts behaviors and helps adopt ideal behaviors than merely changing them. Here you can see images of some early rough ideas and draft concepts of the wall panels. On pre-testing one of the early drafts, which addressed 5 common challenges generally faced by lactating mothers, it was found that it powerfully resonated with them and also affected their desire to not replace breast milk with other alternatives. After several rounds of testing and incorporating feedback from lactating mothers as well as health system and UPSRTC stakeholders, this is what the final version of the wall panels looked like. A teal and fuchsia base was used to make it inclusive and balance any underlying gender connotations. Principles of affect and salience biases were used to create a conversational and narrative-based messaging architecture and tonality. The messaging was framed as a dialogue between the mother-baby dyad, with the mascot, that is an infant, addressing key perceptions on breastfeeding through culturally grounded analogies, minimal textual content, along with simple cartoon-styled illustrations. Cues for messaging were actually taken from experiences shared by lactating mothers during the interviews, which became very instrumental in making it contextually relevant. For example, one of the mothers even quoted what her 2-year-old daughter said when she complained that her daughter was merely just having food, to which her daughter said, "Mama, मैं तुम्हारा दूध नहीं पी रही हूँ, मैं तो तुम्हें प्यार कर रही हूँ," which really translates to, "Mom, I'm not drinking your milk, I'm actually expressing my love for you." The main panel inside the cubicle had a message structured around this verbatim, which when pre-tested really resonated with our users and left them tear-eyed and smiling. Finally, these wall panels were implemented and the breastfeeding cubicle was inaugurated on 30th September 2019. Data from pre-COVID times suggests that an average of 5 mothers used the cubicle every day, who found the space to be attractive as well as comfortable, and the messages to be quite intuitive. What these wall panels have really done is that they have created a respectful and caring environment for severely resource deficient nursing mothers by nudging them towards the desired outcome of breastfeeding without any imposition or force. Anecdotal evidence even suggests that the vibrant color palette and illustrations grabbed the attention of most passers-by. Furthermore, the conversational tonality of the messages, especially the analogies, appealed to the user's cultural sense. In fact, with such a positive response, UPSRTC had also announced to scale these cubicles to 100 bus stations across the state. However, the scale-up has been on hold since early 2020 due to the pandemic, as all government resources, including that of UPSRTC, have been directed towards COVID-19 relief efforts and vaccination drive. So before I conclude, here are some key lessons around using co-creation, that is including key stakeholders at every stage of the design process. What this approach does is that it enables one to map different user types, in our case lactating mothers, and gain an understanding of their needs, priorities, preferences, aspirations, pain points, and how they're dealing with it. Even though our line of inquiry during the sense-making activities was more targeted around understanding their preferences, in addition to this, we were also able to gauge several other challenges that our users faced. For instance, through the interviews, it was found that many lactating mothers didn't receive or had the necessary breastfeeding support they needed, which hampered their breastfeeding practice. As a result, we introduced a remote lactation tele-support system, wherein a lactating mother using the breastfeeding cubicle could dial the mentioned helpline number to directly consult with a lactation expert, all free of cost. This was even trialed in the Kesabag bus station cubicle. Co-creation also helped us develop contextually relevant content as we understood the theme, messaging structure and tonality, visual imagery, etc. that would resonate with our users. We knew what message to convey in those few minutes inside the cubicle and what would exactly speak to them. This also helped us lay out certain guiding design principles to ensure relevance and acceptance. For instance, we tested different color palettes and visual imagery before really finalizing it. Therefore, we narrowed down to a vibrant color palette that grabbed everyone's attention with simple illustrations to ensure the visual imagery is self-sufficient in conveying the intended message, even to users with limited literacy. This process also gives vulnerable populations like rural lactating mothers a voice to share their thoughts, their concerns, giving them a sense of empowerment and belongingness that yes, their inputs matter, which may not necessarily be the case otherwise. In addition to this, the iterative process, which is part of co-creation, also helps quickly design, test, and validate the solution with a smaller sample set before really implementing it on the ground, which again includes both pilot and scale. This not only enables contextually relevant, effective, more nuanced solutions, but also makes it a very cost-effective and time-efficient process. It basically tells us whether this solution is even needed. Does this work? If it does work, then what is its impact, etc. Co-creation also enables ownership of the solution by the users, since they are the ones who helped design the solution. So it's essentially designed by them and for them, which in turn increases the possibility of acceptance and adoption towards the solution and helps achieve the desired behavioral outcome more effectively. So I'll pause here, but thank you so much, SBCC Summit, for this opportunity. And please feel free to reach out to me if you have any questions or would like to learn more. Thank you.
Thank you, Sarah. As I said, that was a fascinating, fascinating case. And it really spoke to the three principles that I mentioned earlier. You took something that it was an insight that, it is a practice that is actually desired, but often not possible to perform because of various challenges. In this case, it was the time and place challenge, and you actually created a spatial solution. In effect, you created a touch point where the lactating mother felt comfortable to breastfeed her child. And because you expanded the boundary of communication by creating the SBCC materials in that space, what you also did was you reinforced the necessity of carrying on with that practice. We all know that in terms of awareness, exclusive breastfeeding is something that people largely have knowledge about, but there are many barriers that stand in the way of it being practiced. So very, very interesting example. I'll just take this opportunity to also remind the audience that you can post your questions on the chat, and we will collate the questions and have a Q&A after the next presentation. I wanted now to hand over to Miriam, and before Miriam starts, just wanted to sum up what she's going to, or give you an indication of what she's going to be speaking about. I think the program that Miriam will be presenting is focusing on smallholder farmers and workers in the tea sector. And this is part of GAIN's broader workforce nutrition program. GAIN's workforce nutrition program focuses on improving the access and demand for healthier diets using existing business structures as entry point. So once again, you see behavior, the thematic focus of nutrition, making, intersecting with partnerships and thinking out of the box. There's very, very, insightful thinking in actually on target segmentation in what she'll be presenting. And the structures that are there as entry point in workplaces or supply chains are also interesting, as you will see in her unfolding presentation. Investing in healthier diets for workforces offers a clear win-win for employees and the companies or organizations in which they work. So Miriam, I hand over to you. Once again, we'll be playing her pre-recorded PowerPoint. So over to Miriam and her presentation. Thank you.
A very warm welcome and good morning, good afternoon, or good evening, depending on where you are, to this presentation on better diets for smallholder farmers and workers in the tea sector. We are looking at how we leverage business channels to reach vulnerable populations through a multi-component behavior change communications approach. And before we dive in, my name is Miriam Kneepkens, and I'm working at GAIN, the Global Alliance for Improved Nutrition. Let's start with some background. GAIN's workforce nutrition program aims to deliver scalable and sustainable employer-led interventions to improve diets of farmers and workers, in this case in the tea supply chain. And that is because we believe that improving the nutrition of farmers and workers does not only benefit their health and well-being, but it can also give benefits to business, like, for example, improving their relationship with your workforce, or even improving productivity, for example. And by having this win-win situation, it is much more likely that these programs are sustainable and embedded in business practices in the future. And of course, the business also offers a great channel to reach those people, increasing scalability of our interventions. So in 2016 to 2018, we have implemented the Seeds of Prosperity approach in India, Tanzania, and Kenya. And this was a nutrition and hygiene education program provided to tea workers and their families through a 1-hour training session over 9 weeks. So every week, a 1-hour training was given. And this was a global program. So the materials developed were similar for all those settings, but slightly adapted to context to reflect relevant foods, for example, that were consumed in each context. So the pros were that it was cost effective because global and ready to use. It was easy to integrate into existing business training channels because it was only a training that needed to be given. But the cons were a mixed results and limited behavior change impact. So we had decided to redesign this program, take the good things from it, but also look into the things that we could improve. And with that, we have implemented a program from 2017 to 2020, which was a social and behavior change communication program implemented both in Kenya and India. And here we decided to add an element that focused on the accessibility of foods because we had realized that many of the barriers to improve nutrition actually come down to access. And secondly, also collaboration with governments to ensure an enabling environment. The activities in this redesign were designed with the following principles in mind. In order to create behavior change, we needed to create demand for nutritious and safe foods, improve access to nutritious and safe foods, and also ensure an enabling environment. These activities were co-designed with implementing businesses, and we also added a quality improvement lens to it for course correction, meaning that we gathered data on outcome indicators on a frequent basis, and based on those, on reviewing that data, conducted testing cycles and did a review of what worked and what didn't work. So for each of those components, we had different interventions. For example, to create demand for nutritious and safe foods, we included community-based activities like cooking demonstrations or street plays or competitions. We did home-based training, we did interactive games at schools, but also video clips to be shared on social media and nutrition information at retail points, like for example, the health benefits of vegetables for a vegetables kiosk vendor. We aim to increase the access to nutritious and safe foods through the Nutri shops. So these were micro entrepreneurs that started selling nutritious and safe foods to include it in their assortment of their shop in the tea estate. We supported the planting of fruit trees and community kitchen gardens in tea estates, and also provided training for food vendors to sell their nutritious foods at the market. And for creating an enabling environment for nutritious and safe foods, we linked to government initiatives. For example, the Eat Right certification in India, and also the training of health workers at the county level in Kenya. Then we move on to overall results and lessons learned. Because, as I said in the beginning, it offers great opportunity to work with businesses and to embed it in their structures, but at the same time, it has its challenges. For example, the community engagement activities are best implemented in a setting where you can easily reach people. For example, in the tea estates where worker families live on site, it's relatively feasible to implement, but in smallholder settings, there are much more challenges in implementation and also monitoring of the program. Then the project co-design with implementing businesses is really important for the engagement of the company. But at the same time, companies also have many competing priorities, and nutrition may not be on top of their list. Some companies are not interested in reaching community members beyond their direct employees. And that, of course, loses some opportunities to work with the communities where those farmers and workers may live. For example, working through the market that they go to every week. Then the integration of quality improvement approaches. We found that it is very useful for regularly tracking data and also course correction, but it also has its challenges because it's can be quite resource intensive, and there is limited monitoring capacity often in these companies. So then we dive into the results and lessons learned per intervention area. And first we look at demand for nutritious and safe foods. These street plays were very popular and very effective in creating awareness. Also, the cooking demonstrations were very popular, but they were quite resource intensive. Cooking competitions, again, were a very popular intervention. And in the future, we would like to engage more male participation there. The home-based trainings we found were created a high workload for master trainers, and also these master trainers were not always considered a credible source of information. The training in buying centers in Kenya was a promising approach in terms of reach numbers, but there was a short duration of trainings. There was only little time available and very much dependent on the goodwill of the clerks. For the school-based education, we found that children were very excited about it, but teachers did not always have the time to or willingness to incorporate it in their programs. The kiosk seller training in Kenya was a bit dependent on the willingness of the company to spend resources on it, because this is in the communities and not directly only targeting their workforce. And then for the SMSs, we realized that it can be difficult to get everyone's contact details. Social media tends to reach young people. Radio tends to be a bit expensive, especially if it's done in a national show, and a local show might be better suited. Diving into the results and the lessons learned for the access component, the Nutri-shops had some logistical challenges, and one of them being the lack of storage capacity for fruits and vegetables, but also households did not often have the income to purchase those nutritious foods. So one of the solutions could be providing fortified oil in smaller packs so that people could afford it with little money available. For the community kitchen gardens, there was actually little interest and also limited availability of land. For the fruit trees planting, there were some issues with seasonality and weather conditions. And then for the enabling environment component, the tea estate management was not always as engaged as we had hoped. And perhaps a cost-benefit analysis showing them the benefits for their company could help in the future. Nutrition committee could do with some more clear transparency on roles to conduct, but overall was very helpful in delivering the program. And then the health workers training in Kenya had some budgeting issues, and there is opportunity to engage them more in the program, but overall also a promising approach. Overall, we can say that this program has shown some very promising elements in both countries in all three components. Quality improvement has been useful in fine-tuning the program and the interventions component, but also requires adequate monitoring capacity and also support from company management. So also in the future, we would like to continue with this approach where we have reinforced community-based components, reinforced access components, and collaboration with government and private sector for more effective and sustainable interventions. So that was a lot of information. I hope it was useful to you, and we are very happy to answer any of your questions. Thank you.
Thanks, Miriam. Once again, fascinating presentation on thinking out of the box, breaking boundaries. What I personally liked, not just personally, but objectively speaking as a communication specialist, what I really liked from the case study you shared with us, the different elements that you tested out, as you yourself said, because I find these different elements can be applied in many different types of projects, not just on nutrition, but in many other different projects. I also like the way you tested out different types of outreach solutions, from planting of fruit trees to street theater, to using children, and the honesty and integrity with which you have pointed out all the buts. I think that was, for me, the most interesting slide in your presentation. I think that you did it for tea garden workers, but I would see, I can imagine that this kind of a model would be applicable for other workforces on site, as you said, because otherwise there are other sort of challenges. The other thing is that, as I said, it's not just applicable for nutrition, but for other things. I feel that, and this is not just about this particular project, but what you're trying to do with the workforce nutrition program. In a sense, the more we do this, the more GAIN does this, the more chance it has of even changing organizational norms. And I think that is a wider picture, and that is a very important picture. And, if it's a win-win, and the more organizations come out and help organizations such as yours to do these interventions, the more likely it is to, push ahead social and behavior change communication, and expanding the barriers of, expanding the possibilities of communication. So two really, really fascinating, interesting interventions presented, and the learnings are amazing. I think there are already a few questions. So if I can start with the questions, is that okay with my panelists, both Sarah and Miriam? So I'll start with a question that is for Sarah from, in fact, my colleague, Varinder Gambhir, who's our Director, Research and Learning. And the question Varinder has for you, Sarah, is that one of the important considerations in user testing, of course, is ensuring representation across groups, including the ones most difficult to convince about behavior change. The question that she has is, can you elaborate on the groups beyond less than 6 months infants and older, more than 6 months infants and older, that you might have tested the outputs with? Is that clear, or should I have to rephrase the question for you?
That's clear. That's clear. Yeah. Thank you so much, Virendra, for that question. And I think it's a very important one. I think to begin with, I would like to say that, something to consider is that this was a very short durée project. So in a span of a week or 10 days, we had to understand our users' design and deliver the wall panels. So we couldn't really go into too much details in terms of our research and building insights, and therefore designing the materials. And it was a very rapid process. But I agree. I think so. One of the things that we began with, and it was mentioned, we identified a few personas or archetypes, if you would call it, based on the knowledge of breastfeeding versus their ability to breastfeed their infant, and that also
is there a problem here? Can everybody hear Sarah? Sarah seems to have frozen. I see.
Yes, ma'am, there's an issue with her network.
Sarah, would you like to, if you can hear me, would you want to put your video off so that it consumes less of your bandwidth and carry on speaking if you can hear me? Shall we then just pause with Sarah here and go on to the next question that's for Miriam and come back to Sarah when she's restored her bandwidth? Is that what we should do? Okay, so I'll carry on. Here's a question for Miriam, once again, from one of my colleagues, Ragini Pastricha, who's Director Content Strategy. So this is for Miriam. Would you consider demonstrating loss of work days for demand generation for better nutrition?
Thank you for the question. Regina, just to clarify, I think you're talking about looking into the benefits for business on doing programs like this. Please correct me if that's not the good interpretation of your question. This is actually something that we are very much looking into. Because, well, as I said in my presentation, it's a huge opportunity to work with business, to have, to look at the the mutual benefits for both the business. It can be on absenteeism, it can be on productivity, but also a really important one is just investing in the relationship with your employees, having people on board for a longer period, talent retention. I see your comment now, a cost-benefit analysis for both tea garden owners and individuals. So yes, this is definitely something that we are looking into. I have to say that it's difficult to measure. It's difficult to attribute a nutrition program, to have a direct link between, for example, absenteeism and a nutrition program. But we're always trying to make a better case for it. And of course, we realize that these companies have many competing priorities. Nutrition is not always on top of their list, more often not than it is. And it's also not the, you're in the business in the end also to make a profit, and nutrition is probably not the best strategy to get there. But at the same time, it does definitely offer opportunities. We've done a business case study in the tea sector, garment sector, and also the cocoa sector. I can share those links in the chat. And this is something that we're always developing. Yeah, so yes, thank you for your question.
Thanks, Miriam. Could we get back? Is Sarah's connection restored?
Yeah, I hope you can hear me. I'm so sorry about that.
No, not at all. These things happen. Murphy is always at work. Don't worry.
Right. I'll keep my camera off just to save bandwidth. Yeah. As I was saying that we did begin to structure our messages targeted to the four mother archetypes, but then we realized was that, and through our interviews only, this was something that emerged, was that lactating mothers or recently delivered mothers, they don't travel unless the baby in the early months of once the baby is born, and they only travel once the baby is about 4 months or 5 months, right? But then again, the focus had to be around breastfeeding or reinforcing the practice of breastfeeding. And also, like, UPSRTC wanted to make it a little broad in the sense that, you sort of cover all the different types of mothers, who would be traveling using the services of UPSRTC. So therefore, the categorization or division was sort of broader. even though we would have liked to keep it a little more targeted in that sense. And that was the idea, based on our learnings from the first cubicle that was implemented at Lucknow. We had envisioned that, okay, let's see what the response is, and let's also see whether the messages that were put up, do they resonate with the mothers. But yeah, in terms of, so we couldn't really test it with the mothers, using the bus stations, for example. But the materials in the pre-testing were tested with lactating mothers in public health facilities within the Raebareli district. So that is what we ended up doing. And thanks for your question. I hope I answered your question.
Oh, I think you answered very well. I had a question for both of you, actually. These are obviously very specific, targeted interventions. What are your future plans? And I'm talking about endemic, which is, living with the pandemic or a post-pandemic world of taking these interventions forward. Miriam, you've already mentioned that you've done similar work in the garment industry as you have done on the tea estates, but anything else? So two specific questions. Are there any plans of, scaling this up or taking it to different geographies? That's one for both of you. And the second is that this is for Miriam, actually. Do you, alongside doing these interventions for the workers themselves, so the workforce themselves, have you kind of designed a module that can be used with the employers? Because as I said, this also involves a lot of change in the employer mindset. And that, I think, would be really, really useful, not only for GAIN, for any of us wanting to do work like this, not just on nutrition or health behaviors, but even while we start working on climate action, we will have to be increasingly talking to employers or manufacturers, right? So are there any plans where we can take lessons from the work you've done and take it to another sector or to another thematic focus area altogether? So if we can begin with Sarah about your plans for expansion in an endemic or post-pandemic world, and then to Miriam.
Sure. Yeah. So yeah, as I mentioned in the presentation, UPSRTC was really impressed with the response, and they actually wanted to expand the initiative to 100 more bus stations. But again, the pandemic hit, so everything had to be on pause. I think definitely this can be expanded to, to across India and even beyond. Even beyond. But again, I would say that the messaging on the wall panels may differ, because again, this was more specific to the UP context, right? And so, of course, the changes that mothers across India or even globally, some of the challenges would be the same. I mean, would be similar, but there would be something very specific, right? And even the way the messages are structured, for example, would differ. So I think that would be the way. Of course, it needs to be contextualized to the region, but yes, there is definitely scope of this being replicated to other geographies. I think UPSRTC would love to do that, and it is also stands as a model of inspiration for even other states in India. But I think right now the focus is, the priorities have shifted more towards COVID and COVID relief work. So not sure where that is, but yeah, there can be definitely replicated to other geographies.
Well, I hope you have support when the priorities are a little less burdensome on COVID. Miriam, before I come to you for your answer, there's another quick question for Sarah from Ragini. The question is, given the high number of institutional deliveries, do you feel LMOs and staff nurses can go beyond delivering the baby and focus more on immediate breastfeeding? If you can just share your answer with us before we go on to Miriam. Thank you.
Yeah. Yeah, I know, definitely. I think the focus has to be on immediate or rather in early initiation of breastfeeding, and I think that has been a push from the health system, and of course we all know the benefits of early initiation of breastfeeding, and it really it closely aligns with newborn survival. Again, but there are different, I would say, various reasons why that does not end up happening. And it could be at both ends, at the service provider level and even the mother at her own level. But definitely that is something that should be encouraged and is being encouraged through the health system. And one of the ways that we were actually working on this was by promoting the method of kangaroo mother care, which is essentially skin to skin contact. So right after the baby is delivered, keeping the baby on the mother's chest instead of taking the baby to the warmer, for example. So this is something, and again, there is a lot of evidence on it, and community empowerment lab was actually specifically focusing on promoting KMC within UP. So the KMC, for example, facilitates milk let down, and that is something, again, which is a challenge many a times these days. Many mothers face that I haven't been able to feed my baby because the milk hasn't come, and therefore they end up giving other alternatives, right? Either they end up feeding the baby some animal's milk or formula milk. So this is like one way that we have been working towards, using KMC, promoting that, and how that has a direct impact on early initiation of breastfeeding and improving the breastfeeding practice. So yeah, thank you.
Thanks, Sarah. Miriam, you remember the question, right?
Yes, I do. Thank you so much for the question. And looking at where we are going, maybe just a quick recap of where we came from. I think this workforce nutrition program in GAIN started in 2014. And we've been focusing on sector transformation. So in the tea sector, for example, where this program is an example from, to work together with tea companies globally to get it, integrated in their programming, in their business structures, to get nutrition on the agenda. And we've done similar things in the cocoa sector and the garment sector. So that has been a wonderful journey with a lot of learnings, successes. But also at the same time, we realized that it's not every sector is open to putting nutrition on the agenda. For example, the cocoa sector, there are so many challenges on child labor, on deforestation, on living income, that it's simply a bit too much to also focus on nutrition. So we also, besides this sector strategy this route that we're taking, we've also partnered with the Consumer Goods Forum, which is a member organization of fast-moving consumer goods companies, to establish the Workforce Nutrition Alliance. And this is what we did in 2019. And our objective with the alliance is to advocate for workforce nutrition globally, but then also to offer support to companies. So it really has yeah, it has so many opportunities because CGF is focusing more on high income settings. GAIN is focusing more on low and middle income countries. And there is such great learning between the two different settings. And also we are working with a lot of organizations that are interested in both implementing this at headquarters, but also in their supply chain. So it's a wonderful way of complementing each other's efforts. And then it all starts, of course, with advocacy. But then we also have very practical tools to offer at the Alliance. And I can share the website link with you later in the chat. But we have developed a scorecard self-assessment where companies can see how they are doing currently when it comes to improving nutrition of their workforce. And this is focusing on 4 different areas that we are looking at. So that is providing healthier food at the workplace, nutrition education, breastfeeding support, and also nutrition-focused health checks. And with this assessment, we of course also give recommendations, like these are the areas you may want to focus on a bit more. This is where you can improve. And we encourage companies to make commitments towards public commitments towards workforce nutrition. And actually at the Nutrition for Growth Summit last week, we had some wonderful companies making commitments, Google being one of them, but also Olam and Unilever. So that is great inspiration for others as well, of course. Yeah. The next step, once those commitments are made, is then also to offer technical support. And this is actually something that we recently launched that I'm facilitating, which is called the Technical Support Program. And in this first cohort, we are working with 20 companies from across the world who want to implement workforce nutrition in their own setting.
That's absolutely fabulous. I'm just conscious of the time, and yes, we've got 3 minutes left. Thank you very much. Thank you both, and thank you, Aseem and Ishita, for facilitating this session. As always, at the SBCC summit and attended, summits in the past, I walk away personally from this session with many different types of learnings, things that we can use in all the work we do, whether we are working on nutrition, whether we are working on sanitation, whether we are working on livelihoods, because there are certain universal insights and ways of working that both of you have shared with us, and your learnings that I think will benefit us hugely. And if you can, in the chat, share any links that you might want us to have, from which we can, again, take more inspiration and actual learnings, that would be fantastic. Thank you both. This has been a very, very fascinating conversation for all of us, I hope. And thanks to those who have asked questions. We've just managed to finish on time. So I don't know what we would have done if we had more speakers, but thank you. Thanks a ton.